Ear infections are one of the most common reasons parents take their children to the doctor. While there are different types of ear infections, the most common is called otitis media, which means an inflammation and infection of the middle ear. The middle ear is located just behind the eardrum. An acute ear infection is a short and painful ear infection. Ear infection symptoms. In infants, the main sign is often irritability and inconsolable crying. Many infants and children with an acute ear infection have a fever or trouble sleeping. Tugging on the ear is not always a sign that the child has an ear infection. Symptoms of an acute ear infection in older children or adults include ear pain or ache, fullness in the ear, feeling of general illness, vomiting, diarrhea, hearing loss in the affected ear. The ear infection may start shortly after having a cold. Sudden drainage of yellow or green fluid from the ear may mean a ruptured eardrum. All acute ear infections include fluid behind the eardrum. You can use an electronic ear monitor, such as ERC, to detect this fluid at home. The device is available at pharmacies, but you still need to see your doctor to confirm any possible ear infection. Ear infection treatment. Some ear infections will safely clear up on their own without antibiotics. Often, treating the pain and allowing the body time to heal itself is all that is needed. Apply a warm cloth or warm water bottle to the affected ear. Use over-the-counter pain relief drops for ears, or ask the doctor about prescription ear drops to relieve pain. Take over-the-counter medications for pain or fever, such as ibuprofen or acetaminophen. Do not give aspirin to children. All children younger than 6 months with a fever or symptoms should see the doctor. Children who are older than 6 months may be watched at home if they do not have a fever higher than 102 degrees Fahrenheit, more severe pain or other symptoms. Other medical problems. If there is no improvement or symptoms get worse, schedule an appointment with your healthcare provider to determine whether antibiotics are needed. Antibiotics. A virus or bacteria can cause ear infections. Antibiotics will not help an infection caused by a virus. Many healthcare providers no longer prescribe antibiotics for every ear infection. However, all children younger than 6 months with an ear infection are treated with antibiotics. Your healthcare provider is more likely to prescribe antibiotics if your child is under age 2, has a fever, appears sick, is not improving over 24 to 48 hours. Make sure you or your child takes the antibiotics every day and finishes all the medicine, rather than stopping when symptoms go away. If the antibiotics do not seem to be working within 48 to 72 hours, contact your doctor. You may need to switch to a different antibiotic. Amoxicillin is commonly the first choice. Other antibiotics that may be given are azithromycin or clarithromycin, chieftanir, cefuroxime, cefpodoxime, amoxicillin clavulanate, augmentin, clindamycin, or ceftriaxone. Side effects of antibiotics include nausea, vomiting, and diarrhea. Although rare, serious allergic reactions may also occur. Some children who have repeat infections that seem to go away in between may receive a smaller, daily dose of antibiotics to prevent new infections. Surgery. If an infection does not go away with the usual medical treatment, or if a child has many ear infections over a short period of time, the doctor may recommend ear tubes. In this procedure, a tiny tube is inserted into the eardrum, keeping open a small hole that allows air to get in so fluids can drain more easily. Tympanostomy tube insertion is done under general anesthesia. Usually the tubes fall out by themselves. Those that don't fall out may be removed in your doctor's office. If the adenoids are enlarged, surgical removal of the adenoids may be considered, especially if you continue to have ear infections. Removing tonsils does not seem to help with ear infections. Ear infection is a common disease, yet every individual needs unique treatment and care. We encourage people with ear infection and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices.